Thanks for having me here today. So yeah, I invented the balance matter system that a lot of you have used in the classes. And then kind of went in a little bit of a different direction working with engineers because I had a vision of having different sounds. And, right now you have the clickers, but I wanted sounds for left and right, things like that. So I've been working with engineers for the last 3 years, tried to apply for a really big grant to actually expand that, but that at the same time didn't get the grant with everything going on. With grants this year, but then happened to meet this group in Switzerland, and they were doing some similar work on motor learning and feedback. So I started working with them and really smart engineers, and now I'm helping them with the clinical utility. So I'll be showing that, but we're definitely going to be moving around during the lecture. I don't want you guys just listening to me the whole time. And I like to be a little bit more free. So if there's questions, raise your hand or things like that. Please, we could do that throughout. If it seems like there's a lot, then we might hold them for the end based on how the group is. So we're going to really be talking about walking. So I want to educate you on just what is gait, right? And what is cueing, right? So those are the two concepts that we're really going to be talking about. But I also want to energize the sensory system. Sometimes we think of movement, we think of just trying to get stronger and work harder, but sometimes our sensory systems actually can help improve our movement. So we're going to be talking about our sensory systems. And I really just hope you leave a little bit more empowered of maybe understanding your walking, understanding some of the science and literature. I'm a complete nerd and read a lot of literature. So if you want more questions on it, let me know. I try not to put too much in the lecture, but a lot of things, there's a lot of really great research that's coming out, new technology that's coming out. So I'm here to explain all that. So I want to get everyone kind of energized to start, because if you just ate, we kind of go. So I'm going to have this movement. I developed an intergenerational program and worked with kids in Denver. And I think it's important to kind of feel energized and to have that self-efficacy that you can make positive changes, right? So I think we'll be talking about some changes that happen with walking, but the good news is if you work hard and know what you need to work on, you can get better at it, right? So I want everyone to put their arms up and say, I can. Like, so I can, like, right? So that you should even feel better when you say I can. Now I want you to put your hands on your hips and say, I will. All right. And then I want you to slam your fist and say, I must. All right. So if you think I can improve my walking, I will understand or become more aware of everything. And then I must, you have to do it. Once you're aware, you have to do the work, right? So I want everyone to remember those 3 motions. We're going to do it 2 more times. All right. And then I'm going to quiz you later maybe to see if you remember those motions. All right. Ready? I can. I must. One more time. I can. I must. All right. Awesome. So remember those moves. All right. Now we're going to march. All right. So this is a little awareness piece. I would have you guys standing, but there's not going to be enough room. I want to sit. So we're all going to do this in sitting, where I want you to start just paying attention to your marching. So this would be more for walking, but marching in place would be the closest I can get, except we're just not moving anywhere, right? So I want you to just march. And if there's anyone, I'm from New York originally, I'm from Denver now, but you can call out, what are you paying attention to? I hear a rhythm. We're all kind of going in beats, right? What else is anyone paying attention to? All right, so I want everyone to stop for a moment. I want you to think of, so how high you're lifting. Are you doing symmetrical motion? Are you getting entrainment, right? What was that old video when they were moving their head and then everybody kind of moves to the beat, right? So are we all of a sudden, somebody might have started that pace and everybody kind of went on, right? Now what happens if you actually, let's do it with a visual cue. So if you put your hands at a certain height you want your legs, you get to pick where you want it, right? So you can go really high, you can go here, you can go out to the side, wherever your hands are. Now I want you to march and see, can you get to your hand? Don't move your hands though, keep your hands there. Does that change? I hear a different rhythm now, right? All right. Now what happens if you're doing 2 things at once? So we're going to really challenge you guys right now. Let's say I can, I will, I must while you're marching. Ready? So start marching. And ready? I can, I will, I must. I can, I will, I must. You see how that can change your walking. So there's also music. Does anyone exercise to music? So what happens to this? Now, arch to this. A music therapist made this for me. Does that change your beat a little bit? Now it's gonna go fast. Go fast, go fast. So that also changes, right, how you would move. Did you move a little faster with the faster music than you would have on your preferred comfort marching, right? So how we're exercising, feedback, and all of that changes. So we're going to be talking about that. So first, I want to know, how much are you aware of your walking? Does anybody in this room know their walking speed? You can raise your hand if you do. Okay, so there's a few that do. Walking speed is considered almost the next like sixth vital sign. There's a lot of correlation with our speed. If you're lower than 1.0 meters per second, you have a higher risk for hospitalization. For other aspects, 1.2 meters per second, you have to be able to cross the street. All right, so that was important when I worked in New York City, because people that was their goal. Can I cross that avenue versus the street? It depends on how far you have to walk. Do you know your step length? Does anyone track their daily step count? Okay, so we're going to talk about that a little bit. Why is that important? Why is it maybe not important? Okay, and then how do you feel? Is your walking automatic? Is it challenging? Is it effortful? Raise your hand if you want to improve your walking here. All right, so that was a very general question. Improve walking, right? What does that mean? And that's what we're going to talk about. Because if someone came to me and said improve walking, well, what? Right? I have a daughter who's a soccer player right now, and if she's like improve shooting, well, what do you need to do to improve that shot, right? What does she need to work on? So the same with walking. What do we need to work on to improve that walking? So why are we talking about walking? There is so much research on the benefits of walking. So if I can get people to walk more, I was at a conference recently at the end of last year and was sitting at a table with a bunch of neurologists. And the one question I asked them is, if there was one thing you wanted to know from your patients, what would it be? And he said, I want to see that they're walking more, right? But how do we know where they start, right? To be able to do that, we need to know a baseline. So you can read there, I don't have to list all of that, but lower risk for all of that if you're walking more. The 10,000 steps, that was an arbitrary number, but since they had that number, there's been tons of research to say, well, is there a magic number? All right, this came out last year as a meta-analysis that's around 7,000 steps a day, and that's an average. There's some days that we walk, if you look at the average for the week, there's days that you're going to walk more, but in that week, can you get to 7,000 steps? But if you're only doing 500, and I tell my clients, if you do 501 the next week, that is still an improvement, right? So I want you to know, like, where are you and how do we get you to walk that you are enjoying walking, that's walking's easier for you, and monitoring that over time. So walking, how is it controlled? Does everyone know the three sensory systems that we use for walking? Because it's not just our strength. So we use our eyes, right? So our eyes help us to know if there's an obstacle. So if I was walking and I saw this cord, my eyes already did what it's called the saccade. My eyes jump and see kind of a memory of the room. So I can know to walk around things. If your eyes aren't doing that, then all of a sudden you have to react. So if I'm here, and just walking here, I don't feel, right? So your eyes are actually help scan the environment to help you walk. Your vestibular system is in your inner ear, okay? It's not just for hearing your ears, okay? Your ears actually write you to vertical, right? So if I'm from Colorado, if I was sitting on a rock, right, that was slanted, would I be sitting like this? No, right? My head and my eyes actually orient to vertical to kind of see. So your eyes and your ears kind of work together to help us to know where we are in space. All right. So we'll talk a little bit more about these three systems. And then the last system is our somatosensory system, or proprioception. So everybody put their hand like you're like a muscle, like you're giving your muscles, right? So this is 90 degrees, right? We're doing a 90-degree angle. So I want you to look at that angle. Does everyone have 90 degrees? Right? Who's the math whizzes here? All right, now put your arm down. Close your eyes, but make sure you don't punch the person next to you, okay? And I want you, or do it in front of you, I want you to make another 90-degree angle with your eyes closed. Look at your hand and see how correct you are. Okay. So this is without, we can feel where our joints are in space. Right? That's our proprioception. So do I know that I am getting my heel here? Do I even feel that? Do I know that I'm changing surface? That's all our somatosensory system. Okay. That all goes to our brain. So those systems maybe are working well, but what happens in the brain? Then they all go to the brain process of how we use all them to be able to actually get our movement there. And then our muscles help with that movement and biomechanics. So there's 3 ways to assess walking. First is our capacity. How far can you walk, right? So I might do a 6-minute walk test because maybe my endurance, I can only walk for 2 minutes and then I'm just tired. I need to sit down. So that's something, what is your capacity? How much assistance do you maybe need for some walking? Maybe you need assistance outdoors or maybe just certain times of the day, but what is your capacity? Versus what is the quality of your walking? So this is looking at what is your step length? What is your speed? We're going to talk a lot about these, the variability of your stepping. Does your foot clear? Or does you walk really well here, but then all of a sudden your foot catches, right? Or what happens with all those aspects of your quality of your walking? And the last is the most important. This is your performance. This is what you do in your normal life, right? Are you walking to go travel? Are you walking to go to a baseball game? What are you doing, right? Because walking's to get us somewhere, right? So how are you walking your dog? What are you doing throughout your day? How much are you walking? All right. I just went to a big physical therapy conference last month, and one of the articles that they're looking at is sometimes your capacity and your quality doesn't match with your performance. And this is what's super important, and I think that we need to be addressing, because some people are getting stronger, their endurance is getting better, but they're still not walking more. And the goal is we want you to walk more, right? So how do we get you to do what you love to do? So what also determines walking performance? It's not just a capacity. So that middle one is what we just talked about. How long you can walk, what is your quality? But then that next ring, and this is from an article looking at your personal factors. What is your mood, right? What support system? Maybe you're not walking as much because you want to walk with someone and don't have somebody to walk with. Like I have one client, his goal is to be able to walk in Denver to the library, which is 1.5 miles. But he's like, Eric, I can't walk there unless I have somebody to walk with. So then he's not doing that. So that support is what's limiting his performance, right? Versus what is your motivation? Maybe you just need that accountability. You need that walking buddy. I would love to have more walking buddy programs, right? To be like, hey, how many steps did you take today? How many, like there's research that supports if you have an accountability buddy, you'll walk more. So if that's, you see how each ring you have to kind of figure out what's causing you not, is it your capacity that's limiting you to walk more, or is it any of these personal factors? Then there's the environmental factors, right? So I have one client who will not walk outside when it's windy out. Denver, there's sometimes it's really windy, and she's like, Erica, nope, I'm not walking right now. So if that's her limiting factor, it's environment. Do we have a second plan for that? Okay, so it could be maybe when I have to rush across the street because of the traffic, or maybe I don't like busy areas. So all of this should be part of your plan to know, well, what is it? It's not just the muscle strength, right? Or there's other aspects of it. Does this all make sense of what we're looking at? So our walking has a unique signature. So this actually picture on the right is from the Swiss company that is actually, they can look at all the raw data, and I think it's like a cool image of what your walking looks like. But these are all the different patterns. So we're looking at your pace, your rhythm, your postural control, your variability or consistency of your walking, and your asymmetry or symmetry, right, of your walking. So all of these help us understand what is your gait signature. So did some of these look familiar that can happen with Parkinson's, right? Sometimes there's shuffling of gait, slower walking, freezing of gait, your foot catching, sometimes hard to get started, sometimes with turns. We're going to talk about turns a little bit more, right? Most of us don't walk in straight paths. Like even in this environment, look how many turns and like paths we have. But maybe it's just with dual tasking, carrying a plate or talking to a spouse. So all of this can change with Parkinson's, but I think it's also important to know these small changes might occur. So how do we capture some of these small changes? Because, right, it's like almost I have kids, like my one daughter grew so much this year. I don't see the changes, but then someone else sees and she's like, whoa, she's 4 inches taller. She looks like a different kid. These little changes we might not see day to day, but can we capture them so then we know what we need to be working on? So I think this is really important that we need to be able to, the research is showing we want to target based on what we're seeing, but if we don't seeing it, we don't know what we need to be working on. So the Michael J. Fox Foundation, I love a lot of the work that they're doing. I know this is a little bit of a busy slide, but it comes from a research article. Experts from around the country came as a gait advisors committee, and they were looking at saying for Parkinson's, they recommended that these measures should be taken with everyone. What I like about these measures that they're looking at is they want to do 1 minute of your comfortable gait speed, 1 minute of your fastest gait speed, and then 1 minute of dual task. Because what happens, I had one client, she walks fine, comfort. All her gait measures, I analyzed her with the shoes, everything looks great. When she's dual tasking and attending to her dog or her husband, that's when her walking falls apart. So if all my training is just regular, I did a disservice. She needs to be training dual task while she's walking. Another person only changes her heel strike angle, decreases a lot, and her foot doesn't clear when she starts walking faster. But if she's only walking at a comfortable pace, that's not going to help her. So we have to kind of figure out, well, what are we working on? And then how do we progress that for each person to make it more individualized? So the cool part about some of these wearables and technology is it's actually able to translate this research into something that we can actually collect. So here at the center, they have the shoes that they're actually able to look at your gait events, measure all that. But then I'm going to talk about, they're going to give you feedback or vibration to help you at different phases of gait. Also that companion app to be able to monitor your time and progress. So this is just an example of just showing, and it's very, just a quick example of showing what is your heel strike angle. It actually measures every step. It can show you how big of a step, how small of a step, how much you're standing on one foot versus how much you're swinging on one foot. So if you're mostly on 2 feet versus you should be 60% only and 40% looking at swing versus stance phase. So these are the things that they can measure. And then we can have this whole platform to be able to actually monitor you over time. So you can see, does your step length change? Does your stride length change? Does your speed? Maybe doctors in Switzerland are actually looking at it for changes in medication because, right, you might go to the clinic and you walk great, and then all of a sudden at home at certain times your walking changes. So is this going to actually help us be able to give better care for that? So another, like I said, I read a lot of articles. Another article that came out last year was looking at, you need to have this movement analysis, but targeted intervention. So this is where once you understand your walking, you're going to be able to understand what kind of exercise you need to be able to do. We talked about these early changes. How do we track over time? But I also think we need to know what's happening outside of the clinic. So if you are using any kind of wearables, even from your iPhone, so if you don't have the shoes, what is your step count? How does that change from one day to another? I had one client, every beginning of the session, I open up his phone and I say, let's see what happened this month, and let's compare this month to last year. Is there changes, right? So then and he knows I'm coming every month, so he knows I'm going to be looking at that. So his wife says if you don't come, then he doesn't have that accountability. So all of that is super important. Motivation, when you know you're being monitored for metrics, you actually do better. There's science and research on that. So if you know that, hey, I'm going to be looking right, you will do better at that. So physical therapists actually, and a lot of doctors have, and OT have these clinical practice guidelines that experts come out with every few years. All these on the left, this is kind of the recommendations. They look at the strength of all different studies on what they recommend. So they look at the research. The big ones on the left, you're doing here, right? You're doing community exercise and community programs. That's giving you that social support. You're doing gait training, you're getting cueing, task-specific training, right? You want to train if you're having a hard time getting out of a chair, you better be working on getting out of a chair, right? So all of this you're doing. This external cueing is highly recommended, and this is what we're going to be talking a little bit more about. So first, we have to measure your movement, find out what we need to work on, target that based on that movement.
give you cues and feedback on how you're doing so we can improve that, right? And then track to see, did that get better, right? So this is what should be happening when you're doing exercises to be able to do that flow. So I'm going to give you an example. This client, this is an older video. This client over COVID, when I couldn't see people as much, sent me a video of himself saying, Erica, can you help me? I'm having a hard time. My family's starting to freak out every time I get up from the table in the kitchen. And he's like, I just don't want, he felt fine. He was more worried about his family freaking out. So it was talking about his turn. So how many times, how do you guys all feel getting out of, so when I think of walking, I also think of if I'm getting up from this chair right now, I have to go somewhere, right? I'm going to take a step and then walk. Okay. A lot of times there's a table in front of us when we do a sit to stand, a desk, a kitchen. How does that change our walking? So I want you to watch the video for a minute. And I want you to think about, even if you were getting up from your chair now, I don't want everyone to get up and move right now, but where would your legs be? What is that step? So see if you watch him move. And he was okay showing this video. Watch his first 2 steps here. Tell me what you noticed on the right. Then he does it faster. So, right, all of a sudden you need to go, you're afraid something's burning in the kitchen, right? This is real life going. Then I was just curious. I asked my husband, I was like, I just see how you get out of the chair? Let's see what normal movement is, right? So I want you to see the position of his head, right? Look at his head down that way as he's going for those first 2 pictures. Look at the position of his feet and where for the second one. So we're going to do an exercise right now of awareness. So this is something I do with the shoes to give increase. We talked about this proprioception. So I want you to just see for me, if I had to turn this way, right? And I was going, and I stepped here, and then my next step would be here to turn. Right? If I take a bigger step out, you see how that's going to help me not have that crossover step. A crossover step decreases your stability, right? So look at my base of support. If I just go here, and now I want to go here, and I go here, you see how that's going to change my stability and my balance here? Versus if I start knowing where my leg is in space and saying, this is where I am, and here, you see how that's going to change your stability. So sometimes it's breaking up this task of, well, what's going on? First, you don't even know, right? Maybe I get up, but not every time I do that. So I actually made my mom go to every different part of the room and watch, did she do a step turn or a spin turn, right? They're very different. So if I got up and I went here, if I initiate with my right leg, this is a step turn, and I'm able to have better stability. If I turn this way and I initiate with my left and spin, do you see how that is less stability? So when some people come to me and they're like, Erica, I have a hard time at turns. Well, what kind of turn? Where's the situation? Where's the environment? Do you see how all of that's going to change how we're analyzing and what kind of treatment we're giving you to improve that? So this one exercise, I want everyone, we are a little close together. So let's just do it a little bit, but kind of bringing your leg out and back in. Do you have the hip range to even do that? Maybe your hip mobility is a little bit less, right? Maybe you don't know where your leg is, so you think it's where it is, but it should be a little bit out more. So do you see how the more awareness you have, that will help with that? So we'll do more exercises when in a few minutes. So here's just another example of this crossover steps. So this was another lady I worked with. And that first, I couldn't get the video on there, but the first one you could see how much she crossed over. So the same thing, she was trying to get to her kitchen and felt like every time I go to my kitchen, I feel like I'm not, I don't have the stability. And it was the crossover step. The minute we just corrected and got her to have that better position, she felt more stable, okay? So what kind of cues, instructions help your walking? So what kind of feedback do you like? Does anyone want to kind of shout out, like what kind of feedback does helps, or even just a sport? What kind of things do you like to improve your movements? We've got a quiet group. All right, I'll get you guys to think about. So what about auditory feedback, right? Do you want someone just to give you that cue to say, move faster, right? Or tell them to like be bigger, right? You could use that verbal, or clapping to get to that beat, right? That's gonna, or a metronome, that's all gonna be auditory.
What about visual feedback? Does anyone use mirrors in the beginning, right? To kind of know where their body is, or maybe a picture, right? To kind of look to see what you look like in that. And then there's tactile feedback, right? I could be tapping you, or I can be moving you into the position, or you can getting that vibration, right? Those are all the different types of feedback. Does anyone use analogies to help them move better? Lots of research, analogies. There was one good study about a basketball player. If I went like, right, I don't play basketball, but right, you're supposed to make your wrist go like this. Am I right? Any basketball players, right? But if I was like in a game, have to think of where my wrist is, right? That you can't really do that. That doesn't become as automatic. You have all this other stuff. But if you think of putting your hand in a cookie jar, right, then that gets your hand in there. So sometimes there's analogy learning actually becomes more automatic. So if you can think of analogy, so you're going to see I came up with some exercises that I also use analogies. One analogy might not work for everyone, but if you can think of analogies, that helps. Also, we talked about just knowing the metrics, knowing what you need to work on improves motivation. Just seeing where you're at and then how you're progressing actually motivates people. Video replay. This my daughter uses a lot in soccer. Her soccer coach will take a video and show her where her foot is, and then she knows how to improve that. Does anyone in therapy or in their sessions watch a video and then see afterwards what is improved or what? No? Yeah, there you go. So a video also helps, right? Because sometimes you're not even aware. Sometimes I would love someone to video me doing an exercise and then saying, okay, no, this is where you need to work on, because you might not have that awareness of what you're doing wrong or right. Okay. So these are all ways that we can improve our performance, because first we need to involve and understand what errors or what movement patterns we need to improve, right? So we need to have that for feedback. Then we need to be engaged and understand these, be more aware of these that were more automatic or unconscious. So things that like walking should be automatic. So if that isn't automatic, how do we then engage that and increase attention to it? The more feedback we get, we can improve those outcomes and motivate. So once you actually get the right feedback, you're like, oh, I want to keep doing it right? Once you get that positive reinforcement, you want to keep going, and hopefully that increases your reps. So we talked a little bit that the brain adapts and reinforces. So visual feedback helps us more with seeing of movement. It's looking at the size or the position. So if I like, I'll even show you like a tennis player. I was a tennis player, and if I was learning a new position of holding the racket, right, I have to kind of look to change my wrist and where I need to be, right? In the beginning, visual feedback is very good for an acquisition of a skill, the very beginning of when you're learning. But then you have to fade it, because similar to the lines or the laser lights, have you guys used ever those, right? It's really good, but when the lights are not there, the lasers aren't there, then what do? Right? So you need to be able to kind of fade that. Auditory feedback's really good for rhythm and pace. And then tactile feedback kind of helps with a combination of spatial and temporal movements. So we're going to look at that. Does anybody listen to every what do you call it? Hidden Brain on NPR. Does anybody see if you? It's a good podcast. I listen to a lot of podcasts when I'm driving. It's a good podcast, and this is an old one about, and this is when I used for the Balance Matters system when I was using for clickers. But it talks about using clicker training for feedback. But one thing that I love about it is you can't give feedback if you don't know the task. Right. So if I knew sit to stand and I didn't understand those components, how do I give the feedback to improve that movement? So if you don't understand walking, or you don't understand that aspect, you're not going to be able to give feedback. So the same example of my daughter playing soccer, she keeps telling me she needs to point her toe more. Her coach is like, and I was like, finally watched a game with her last weekend. And I'm like, oh, that professional player, he's pointing his toe really well. And she's like, of course, mom. Like, but I didn't even know that was a part that you need, right? So once you know what you need, then you can train that to be able to get that more. So sensory cueing, if that vestibular or that proprioception, if that movement is impaired, that's going to actually kind of put that signal up a little bit. So it's going to help you with that timing, give you more awareness of where your foot is, right? If something keeps vibrating on your foot, you're going to say, okay, this is where it is. And then it's increasing attention. So sometimes it could be the proprioception that you just have awareness of where your foot is versus just attention to your walking. So there's different pathways of how sensory cueing helps. This is some in the research. They use, the laser light or lines on the ground, a lot on the metronome, using a beat or having somebody to walk to that. And then also looking at the sensory, we're going to be talking more about the vibration. So one thing I was talking in the group earlier, one thing I do like about vibration, I do a lot with music and auditory cues, but you also have to know your pace, right? What is your frequency? Because if I'm using a beat, is that a comfortable pace for you? I don't know, but because I didn't know what your walking pace was, right? So once I have the metric to know this is your comfortable pace, this is your fastest, then I can set a metronome based on those parameters, and that's going to be more customized versus just setting, okay, this is where you're walking. So if you're walking at 80 beats per minute or 60 beats per minute, I don't know where to set it if I don't know where your baseline is. Does that make sense of why the metrics are important? So if your goal is, I want to walk faster, a lot of people tell me I want to walk faster. How do you walk faster? What is gait speed? Does anyone know the definition? I don't quizzing you guys. You guys are quiet. We gotta get you guys. So cadence is how many steps you take per minute, right? And stride length is how big of a step or step length. You multiply both of those, that's your gait speed. So if I'm walking and I want to go across the room, I can walk faster by taking a lot of little steps, right? That's going to get me there. Or I should have tried it. Was that the same time? I don't know, right? So I increased my speed the second time by taking bigger steps. The first time by increasing the amount of steps. Which one do you think is more efficient? Yeah, right. So that is, if you don't know what your step length is or what your cadence is, how do you know to improve that, right? So those are super important to kind of know. Vibration, what I like about it is nobody knows that it's vibrating in your shoe to give you that pace or give you it, where that you need either metronome or music or something like that, or if there's visual lines, everybody sees. So it is kind of nice to be able to have that in any environment. So if you're at like a cocktail party or you're going somewhere and you want to improve that, you still have that kind of cue that nobody else knows is around. Lots of research on cueing. I would say a vibrotactile cueing, the research is emerging. More of the research started with visual feedback, and then it was more in auditory feedback. But here kind of lists different ways. They're still looking at different types of vibration. Some of them are sub-threshold, some of the research, that it's all the time, right? Versus phase specific. It only vibrates at a certain type of timing of your gait. So this is some of the research, a lot of improvements in asymmetry and step length and stride length. On this enhanced proprioceptive processing, they look at the brain, look at different EEG scans. Gait variability that decreases, right? So if your increased variability, that was one of when I was showing you with the Michael J. Fox recommendations. If you're right now, if somebody was walking and they had, sometimes they're taking good steps and they have little steps, you see how that would be variable in your step, right? So that's sometimes harder to capture. Like if I was doing an observation, I could say increased variability, but catches 15% of the 20, but the shoes will actually give you an actual coefficient of variability and a number of how much variable your step length is, how much variable your heel strike angle, all of those kind of stepping. So we know what we need to be working on. So right now, tons of research going on of understanding. These are some of the ones that the company I'm working with is looking at. So looking a lot at haptic feedback or the vibrotactile feedback on gait analysis, and a lot on freezing of gait right now. So there's a study at Stanford happening. One of them is looking at cognitive and gait evaluation at Harvard. There's another study looking at a fall risk report. So some of that stuff you have all access to here at your center to be able to test. What the research is showing right now, this is a study that came out this last year, 2023, is there's not one size fits all. So unfortunately, this is the hardest part that we have to still figure out, and why the research. Why does a metronome and cueing work for one person, but a real-time feedback work for someone else? So this showed you all the different off-state and on-state. Everybody responded better with cues, but nobody responded all the same for one cue. So this is where a personalized treatment is super important. And how do we work on that? So do you respond better to vibration, to a metronome, to visual feedback? Honestly, I think in the beginning, combined feedback, it works the best, right? And that's what a lot of the research is looking. But then do we start taking that away once you start improving that?
considering the person, attention, what is your cognition to follow some of these cues, right? So if you can't follow some of that and your attention goes to it, are you going to be able to respond to that? Do you have fear or anxiety? Sometimes then you don't feel the vibration or you might not feel the cue. Is there ways to reset for that? Internal versus external focus. Okay, so internal focus, this is cueing even just, I'm thinking of where my body is. That's an internal focus. So I'm thinking of where is my heel, where is my toes, right? Versus an external focus is I'm paying attention to the vibration, not my body part, right? Or I'm paying attention to the sole of my shoe to show off the sole of my shoe. So that actually tons of research on how that improves for different types of populations. Affirmative versus corrective. So the shoes can also show every time you take a good step, you're going to feel the vibration. Or I can switch the mode and say, okay, you're taking good steps, you don't feel anything. Anytime you take a short step, it's going to vibrate and remind you to take a good step. So you can change all of those based on the person. We talked a little bit about this continuous feedback versus phase specific. Summary feedback at the end, just that alone kind of is proven to help people, that you get a summary of how you just did, right? This study is, came out in the beginning of this year in January. They're recruiting patients in Europe to look at what patients are influenced by just different types of cues. So they are looking at this a lot more specific on long-term efficacy of the, some of the studies are only looking at short-term, you do it, they are improving what happens over time. They're also looking at different patient characteristics that influence your compliance. So if you have a certain device or something, are you using it? You're not going to get better if you're not using it. What kind of technology is easy and friendly to use? And then the last one, they're looking at the brain, what's happening at the brain level while you're cueing. So this is a great study. It's a multi-center study that's looking at to understand cueing even at a higher level. Because look at all these different factors, right? So we talked about pacing. A metronome is going to help you if you feel like you want to go a little bit faster than your comfort or having that beat, right? When you guys were going really fast, right? It made you work a little bit harder. But you don't know if you're in time with the beat or not, right? You're not getting that performance versus if you have a vibration to say, okay, when you lift your leg this high, it only vibrates. When you lift it here, it doesn't vibrate. That's going to be more performance driven. So there's different ways of looking at what cue will help you. We talked about all the 3 different modalities. Looking at the timing in gait cycle. So maybe I have one client who I put the vibration every time she stands on one foot, she doesn't feel stable. That vibrates so she gets more stability. Where another person, I tell them if this is buzz, 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 right, you get really short versus I want it to be long stride. So you want the vibration to be longer. So can that person attend to that cue would be for your timing. But that attentional, so I kind of talked about 2 things. So even who does metronome here? So a few people say that they walk with a metronome. Yeah. So when you use a metronome, are you paying attention to every time you strike your heel, you're trying to get to the beat? Or are you paying attention to every time you push off? So that sometimes just see how different that cue can change, that might change your movement. Because when I think of walking, did I get anywhere? I take a bigger step. I still didn't get anywhere, right? What moves me forward? Yeah, this back way. So this extension. So one person, she was not responding well with the shoes or taking steps. When I increased her extension, all we did was she was here, so she couldn't get this push off. If she did, now she's forward, and now she's trying to catch up to her body, right? That we see that sometimes happen. So once we worked on this extension, that she's getting this lift up, and every time she feels this vibration in her heel, that improves her walking. So you see how we all respond just a little different until something, this light bulb goes off to say, now I know how to move better. All right. But once we figure out, then you should be able to move better, right? Yeah.
So if you're starting with the shoes and getting better and better, is it a situation where you don't have to wear the shoes anymore, that you retrain yourself, or is this something that you'll have to use the rest of your life?
And I don't know if you're not going to like this answer, but I think it's patient specific, right? So I think some can make those changes. So I even worked with some people who I just used them in training and saw a better effect than without anything. Other people I think might need them more long term or keep switching and changing it, right? So I think sometimes one modality might work for you and then all of a sudden it doesn't. Does your body habituate, right? Like when you like feel like you guys know what habituation is? Does anybody know what that word means? So like even like something that you start getting used to and you don't even recognize anymore, right? If you have like some kind of something on my necklace, I could feel it or something. And now after a while, I don't even feel the necklace on me because my body's got used to that. So if you're starting not to, there's ways to actually decrease that habituation. And there's some research and things that a therapist would work with it. But I think, you know, so if you did get the shoes, I think walking in real time, looking at your gait signature, what I would look at is, does the vibration help you? But I always think if people, some of my patients are like, Erica, I almost don't want to tell you this is easy because I know you're going to make it harder, right? Because you can keep improving. So once somebody can walk really fast, well, and that was their goal. Now I want them to walk fast with head turns. Now I want them to walk fast while they're dual tasking. So how do we keep adding those extra layers, right? To make somebody be able to do whatever their goal is, but maybe they're where they want to be and that's fine. So I think knowing what is your goal of what are you working on? So when someone says I'm working on walking, that's not enough for me. Is it walking because you want to go to Peru and, you know, climb like somewhere and you want to be on uneven surfaces and turn your head and look and talk? Like, what do you want to be working on? So this is what yeah.
But the slippery, like that, what if like walking fast, you have to have it at one level. But doing a task and walking, you have to have it at another level.
Yeah, so I think those are good questions. So depending on if you're using real-time feedback for the shoes, it's always going to go, you're going to feel the vibration and it's going to change with you with the speed. So like I'll explain a few of the modes in a moment that I would use for that. You could switch and say, for like certain exercise, you should switch, but I would look at the mode that helps you with the most of what you're working on. So if it's maybe for speed, if you're going to be practicing walking outside fast, for fast walking is your exercise, and you respond better with the swing phase of, then I would put that versus maybe during regular walking, you need just like the metronome to keep you at a pace. So you can switch that mode for it, but eventually the shoes actually have a capability once someone walks for a long time to actually have AI and start changing the vibration, matching what you need. They're working on that. So that will be in the works in the future. That it would detect what your changes are and then be able to give you that vibration when it's needed. So that's the whole part of, there's a lot of new stuff going on with AI that's trying to learn how we move. But that will be, I would say in another year or so, you're going to see a lot more changes on that kind of stuff with wearables. So I think this is where this positive feedback is when you when you're land on your heel or you take a bigger step, your brain recognizes that's the step we want, right? Because we don't want to reinforce bad behavior. So that's one thing that why I even invented the Balance Matter system was, some patients would come back to me and say they're doing this exercise at home, but then the exercise they're doing is not what I wanted them to do. So maybe I wanted them to stand here, but they spent here the whole entire time. So that all this hard work that they just spent that week they could have done so much more. So how do we at home get the most of our time? If you're putting the work into it, I want you to be getting that work, right? So if you're practicing walking, I'd rather you practicing every time getting that, when you feel that vibration versus I'm walking a lot, but you're not walking as well as you're actually capable of. So I think sometimes we don't do what our capability is. So this is where it would give you that positive reinforcement. We talked about if it was smaller than the goal, we can also set a target that you would actually get that reminder. So let's do a little bit of movement because I've been talking a lot. There was a new mood. You don't have the shoes on to feel it. So you can feel it here at the center with one of the clinicians here. But this one, like I said, I like analogies. Right. So if anyone's creative in the group, I would love more analogies. I ask my kids a lot. They're actually more creative than I am for this. But I think of rocket fuel. When I think of power, what do you think of power and speed? So a lot of people tell me they want to improve their power, they want to improve their speed. As we age, forget about Parkinson's, as we age, we lose power more than strength. Okay, do you know the difference between strength and power? No. So strength is the amount of force that we can lift, right? Right, we can lift our own body weight. What is our force? Power is the force times our speed. So if I'm going a calf raise, this is how much I can lift my body weight. How fast I can do it, that's my power, right? Our power actually helps us more with functional mobility, okay? So if you're trying to say, I want to work on speed, I have so many clients who come to me and they're like, I want to walk faster, I want to move faster. I'm like, what speed drills are you doing? Erica, nothing. I'm like, how are you going to get faster? Right? So you need to be working on that. So this one, there's a vibration mode in the shoes that it vibrates very low intensity when you move slow. And then when you move faster, it goes higher. You feel it more. So you're going to try to increase that feeling that you want to keep it higher. So I'm going to have, let's say, Stephanie, you can come here for a minute. I'm going to give you a little, I'm going to let you push me for a minute. I know her for a long time, right? So you could push me. So if she gives me a push, you can give me a push. Yeah, push me. I took a step, I caught myself, right? So look how big of a step I took based on how much she pushed me. Push me a little harder. Look how much bigger and faster I had a step, right? So this is, thank you. Yeah, so I usually let my patients push me around. So this is important, that speed of your step. If you can only move this fast or this big, how are you going to be able to catch yourself, right? So that would be a training. So one of the tests on the shoes is actually your reaction time and how quick you can do that. So if I see somebody have a low reaction time, this would be an exercise. So I want you to think of a fuel meter. If I was moving, and we'll do it sitting, we can even just go forward or wherever, like side that you have enough room that you're not going to hit your friend. If I go here, how fast can you, and think about it here, you don't even hear me really stomping, right? Because I'm not putting that much force. I want you to put energy. Step. But you're, right? This is, and you would be feeling this vibration in when you have the shoes on, you would be feeling more intensity the faster you. All right. So the first level would be when we were talking about levels, would be just being able to feel that maybe in one direction, right? Then what happens? She pushed, I kind of went to the right, but what happens if she pushed me this way, right? I need to be able to move in every direction, right? So how does that feel if we move in every direction? Now, what happens when it's reactive? So if I say 3, 10, right? 2, that you see is even harder than for that. So when you are planning it and knowing I'm only going to the right, that would be one way to start. And then you see how we can progress that exercise. So all of this would kind of show you how you would be able to move with that progression. So somatosensory training to know where that position is, right? So our body is able to detect the ground we talked about, the surface, be able to know through the load through our ankles. So one of the exercises I came up with was striking your heel, right? A lot of times we talk about that heel strike versus a flat foot. So I want everyone to just alternate kind of striking your heel and then bring it back, striking your heel versus taking a flat foot forward. Feel the difference though. Do it once wrong. Does that feel different? Versus striking your heel. Now, I want you to think of an image. Remember, I talked about mental imagery or analogy. Since this is a Swiss company, I decided to let's travel around the world. So we're going to stamp. And I think of a stamp. When I think of a stamp, you really want to press down on it, right? And that's part of our somatosensory, that loading. Because if I go here, that's kind of a weak stamp. I'm not going to get that image, right? I really want to stamp it down. So now I want you to picture you kind of getting that passport stamp of whatever country. All right. So where should we travel? Which country should we go to? So this is where then you can kind of make a game out of it. Who's good at geography, right? Where are we in Kansas right now? So what's north of us? So go north, right? Now, can you keep going and thinking every time you would get a vibration in your heel to know if you did this, we're going north to Nebraska. Let's add another layer. Name all the cities in Nebraska. Right? So do you see, does that change? Now all of a sudden, did you step with a flat foot? Do you see how that would give you that feedback? Or now can we go east? Can we go west? Do you see how we can keep changing those layers? Now can we even do
So if we're turning, I'm going to make it one more layer. We talked about sensory systems. You guys see these lasers? All right, so our eyes initiate a turn, right? So if I'm going to turn this way, right, and I look this way, right, I'm not going to be able to know where I'm going. If my eyes don't even move, I have no idea where I'm going, right? If I'm now looking here in this open path of where I'm going to go, right? Colorado or skiers, if you're going to ski in the trees, are you looking at the tree? Right? You're going to hit the tree. So I'm not looking at the obstacle. I'm looking at the open path. That is the same for walking, right? I'm looking at this open path of where I'm going to go. Your eyes lead the way. So your eyes go, and then your eyes, your head, your trunk, and then you step, right? So what I'd like you to do is to train that. I'm going to have these laser lights, and we're going to make it simple first. When you see the laser light, I want you to look at it and then strike your heel in that direction. And then if you want, think about where you are geography-wise of where you actually just stepped. So you could do a state, country, wherever you want. Do you see how then you're adding those other layers to it? So is everyone finding it? So I'm also how fast your eyes can jump. So you should be doing eye exercises. Your eyes are just like your muscles that can, and your movement, it can get smaller, it can get slower, right? So our eyes jump around the room to be able to help us. This is a reactive saccade versus voluntary me like looking to be able to go there. So being able to jump around there, do you see how that would then help you add that next layer? And if you are having a hard time with this, I would just have you be moving first with the lights. I have two different colors because then I might say every time you see red, you don't move. Every time you see the purple, you move. Now you have to inhibit because you see it, you want to strike your heel, but you have to stop and not do anything. Should we play that game? So let's try it once. So when you see purple, and I'm going to be moving purple in different directions, I want you to look at the purple, strike your heel. Okay. If you see red, look at red, but don't move, or maybe you can put your hands in the air, whatever you want. Okay. You ready? And it's better, actually. I'm going to go this way so you can see. So some people want to do it, right? So that would be the inhibition. So this is like a no-go signal. So that if that is a problem, like if I'm about to cross the street and now I want to go, but I have to stop because a car's coming, right? That's a different way to train. So do you see how you can train all these, and then you would have the feedback to be able to know if you got that correct or not? Because maybe then as you're doing this cognitive task, are you now just stepping differently? We want the quality of your stepping still to be good. Okay. Versus how many people do squats or bridges or lunges just to get your strengthening? Awesome. Well, everyone's putting their hands up for that, so this is a good one. What muscles are you trying to activate when you do that? Quad. Right. So if there's right, some people are more quad dominant, some people are more glute dominant or hamstring depending. Right. I keep using my daughter's example of their soccer. Her and her soccer coach were talking about how much they're quad dominant because they're kicking all the time. They don't know how to activate their glutes, right? So glutes are important to activate. So when you do a squat, or does anyone have knee pain? Yeah. So if I did a squat like this, I'm not going to do it too much so I don't hurt my knees. I'll go at an angle. You think this would be good for me to? Am I getting stronger this way? What do you think? Yeah, right. But how do I know what I'm doing? You guys are watching me, right? But if I can't feel it and I do that at home, then I just did myself a disservice. You see how this can help? So one way is if I actually set the shoes on load in the heel, you have to shift, vibrate, and then notice now on my way back versus here, right? Now I have all my weight, all my distributions on my knees. Now I just pushed and took away those forces off my knees and activating the glutes. So there are some ways, even bridges. I think we could try it all sitting. Everyone put their feet flat, put their hands on their quads, or if you even want to put your hands on your glutes to kind of feel, or one on each to feel the muscle activation. I want everyone to do
All right, this is the only time I'm going to tell you to do this. So sorry, Blake and Stephanie and Josh, you're going to sit like this. All right. And lean forward and like pretend you're about to stand up. Feel when your quads kind of turned on, or did they even turn on? Okay. Now I want you to push down on your heels. Do you feel your muscles are already engaging? They're already firing to get you ready, right? So this would be a way now, if you lift up your toes like you were about to do a bridge or something, do you feel now your butt muscles even getting engaged? So do you see how the muscle activation patterns of when to start can help if you start knowing where that motion is? So if somebody's doing sit to stand like this over and over again, they're not getting the activation that I want versus here and pushing, right? Pushing down to the ground. So there's ways to actually activate muscles, and there's tons of research. You can look at articles that they put EMG and looked at the muscles when they were activating, which groups were more based on pushing in the heels, pushing at different angles. But if we don't know that, how to change that, how are we going to make those movements? I don't, maybe. Oh, and we did, yeah.
Because I use that
Yeah.
all the time.
Yeah. Yeah, because you want your, so a lot of people for the sit to stand, and we'll go over that. We're going over that in our different course, but a lot of people, they pause here sometimes, right? And imagine pausing here, now you're in a squat, like wow, you're working hard, right? So if that's not the fluidity of the movement, where are you thinking of that termination of where your body needs to end? Or are you thinking of that movement? Do you see how, like, if you start breaking apart the task, where did the break fall apart and where do I improve that? What kind of cue do I help with that? So once you know all that, that will help. This, I put this out there right now because I know there's some people in the group that have freezing. Freezing a gait is still an enigma. I think there's even an article that said enigma of freezing of gait. They're still trying to figure out. There's all these different phenotypes and different types of freezing, and they're still trying to understand. This just came out this year. There's a new definition of freezing a gait, and looking at when that actually happens before the freezing. What does that mean? What type of like when does it happen? What triggers it, right? Is it anxiety? Is it small spaces? Is it turning? Is it initiation to get moving? And how do we treat that based on what we're seeing? So before, there used to be different phenotypes of like shuffling versus, they said like trembling, or versus akinetic of like completely not moving at all. They're changing that a little bit. They're even doing video analysis of trying to understand that. So this tons of new research coming out on new definitions for doctors and clinicians to look at, and how to change that. So the research with the shoes started with freezing a gait. This is where I'm adding more of the exercise components, but this gentleman had a significant freezing. More of like, this is to understand, is it processing that gives them awareness? Is it proprioception? What's happening at the brain? I showed you that one study. They're still trying to figure that out. But I think we're getting closer and on it. So I'll just show a video of him using. So you see a few things when I'm looking at it. Right there, he kind of got stuck. His very short steps, all his weight on his toes. Yeah, let me see if I. So you can see his vision is looking down the entire time, right? So this also will help me understand if I was watching somebody walk that way, to say, do they need to know where their feet are? Why are you looking down? I tell people, are you looking at the new floors? Like what's making you look down there, you know? So if you have to look that far, is it because of you don't have awareness of where your foot position? Does the vibration all of a sudden give you that awareness? So he walked completely different when he had the vibration on. So this was, to him, he felt like a miracle. I think this is, for some people, get this strong of a response. We're still trying to figure out why that response, does that response stay? How do we kind of figure that out? And that's something that I'm working really hard this year and helping as a clinician with the company, because I think we need to keep bridging that gap between some technology and real life stuff. So this, I just wanted to show you, these were his, and I know it has a lot of numbers, and they're going to be having new reports that are a little easier to read for the patient. But you can kind of see right now what his stride length was with no stimulation versus stimulation. What is his velocity, his heel strength angle? So you could see all those numbers. So this was all calculated of what you just saw, and then we can actually then repeat those numbers to be able to see that and how much of a significant change happened, how much standard deviation happened. So all of that is meaningful for number one, the patient to see something, right, that you made a change, but then also to be able to track that over time, so that we can kind of see, is that new medication, did that help me different? Did what, you know, you have to look at the big picture to see that, but I think these metrics are going to help a little bit more. Right now, it's used a lot. Neurologists were mostly using it in Switzerland. Like I said before, clinics are just starting to use it more. And more patients are using it in Europe, just starting here in the US now a little bit more. So these are some of their partners that they've been using. So hopefully this was helpful. Did everyone learn at least one thing today? Any